Hi, welcome to Facebook Live. Can you hear me?
Yep.
Great, this is working. As usual, we're going to answer your questions. Let's get right to the data so we can get to your questions as quickly as possible. So this is our current status. As you notice, we've had about 17 average new cases per day, which has increased. We also have about a 5.8% testing positivity, which is increasing as well. Next slide. This is our graph. You can see that little tail at the end starting to creep up, and that's what we're going to be watching closely. Next step, next slide, and our vaccination rates very flat, although we continue to vaccinate about 600 people a day. We learned that. Oh, so a week, 600 a week. That is still, we're holding steady at about a 51%, 51.5% vaccination coverage of 12 and older of having received at least a single vaccine. Next slide. Which, by the way, is not enough to provide us any kind of herd immunity, even if you add in people who are seropositive from a previous COVID infection. Next slide. Oh, there it is. Okay, this doesn't show up very well, but it shows green areas that have a fairly decent vaccine coverage rate. I was going to look and see what that green is, probably above 60%, the darker greens. If you get into the pink range, that's basically under 50%, and the darker pinks, which don't show up on this, are under even 30%, which is where some of our communities are. So we have not, when you look at average vaccination rates above 50%, we're looking at quite a bit more variability depending on where you live, which is going to be a concern, obviously, when school starts. Next. Oh, wait, that's next slide. Yeah, and just remember, our dashboards are updated regularly. We'll try and continue to report on changes. Currently, I have to say we do not have any hospitalizations. Do we have any hospitalizations for COVID? Oh, we have one now. 1% of our hospitalizations are COVID related, and no current deaths, I believe. Correct. Yeah. Okay. So let's get to your questions. I'll start out by the points that my staff wanted to make sure I reminded you of. One is the easier one is behavioral risk factor survey reminder that we are in the field collecting medical or health information on our population. The survey is completed via a phone call through a third-party call center in Wilkins Research. So your caller ID may show a 423 area code coming in from Tennessee. And the survey, we urge you to answer it because your information is confidential and anonymous, but it's greatly helpful to understand the perceptions and health situations of our community. The survey takes about 20 to 30 minutes to complete. And just as a reminder, we will not be asking any personal questions such as Medicare or Medicaid account details. We will not ask social security numbers, passwords, etc. Some of the questions are personal about your health issues, but we would not be asking you for any kind of ID numbers, etc. If you're unsure about the legitimacy of the phone call, hang up and give us a call at 987-5300, and we'll try and make sure that everything's cool. The other thing that's of note is that I believe yesterday or the day before, the CDC just strengthened its guidance recommending pregnant women should be vaccinated. There's enough data and review of these vaccines to show its safety and efficacy in this population. And we'll quote, COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future, i.e., these vaccines do not impact pregnancy or future fertility, which is an ongoing concern that I think just started with a bad comment and has gotten worse ever since. Okay, should we get to questions?
Yeah, you ready? All right.
Yeah.
These are a couple that came through last night. Is the monoclonal antibody therapy a viable option for a breakthrough infection?
Yes, Okay, it is. The official response. Thanks you guys for printing that. Prior receipt of a COVID vaccine, and that would be any of the approved COVID vaccines, should not affect any treatment decisions, including the use of monoclonal antibodies or the timing of such treatment. So if you got a vaccine 3 days ago and got sick, you would still be eligible to use monoclonal antibodies. Monoclonal antibodies, by the way, have also been approved for post-exposure prophylaxis. So if you are a very high risk of COVID and you have been diagnosed as such, talk to your doctors of getting the monoclonal even before any onset of illness.
All right,
Go ahead.
the next question is, are they testing for the Delta variant or is it just a regular COVID-19 test? Can they tell people who test positive if it is the Delta variant?
So the tests you get for determining whether you have a COVID-19 infection do not check for the different variants. That is not possible. So after you get a test, positive or negative, that just tells you you have COVID. That sample may be forwarded to the State Bureau of Labs where genetic sequencing is then done. And if it comes back positive for a Delta variant, and we are still in the process of communicating that information, you will be notified accordingly. But we just received some notification from the state that in the past week, 99% of the genetic sequencing of the specimens they've received have been Delta. So we are just going to move forward with the assumption that what is circulating now is Delta. Okay, so it doesn't matter whether your test documents that or not. It's not likely that it's anything else at this point in time.
All right. The next question is, why can't you go back to the daily updates format? We don't like the way it's reported out now on Tuesdays and Thursdays with the 7-day averages.
Because the data collection is complicated and labor intensive. When rates were low, there was a lot of variability that I think would have confused people more than helped. And there's actually more value to having general, what's the word I'm trying to think of? Averages, because remember, the difference between 5 cases and 7 cases is kind of irrelevant when you get into the weeds about cases going in and cases coming out of a record. So that variability has confused you all right from the beginning. You're getting lost in the weeds, and quite honestly, we need to focus on the battle right now. The fight is not about the numbers or the cases or whether we're doing that right or wrong. The fight is to reduce the transmission of this illness and reduce the impact of this illness. And by knowing in general how things are moving along every few days, that is, in my mind, a very adequate amount of information for you. If you really want day-to-day updates, I would suggest you go to the My Start dashboard, which does that updates how often? They do 5 days a week. And we do our dashboard daily. That's right, I forgot to say that. So if you go to our dashboard, we do update that on a daily basis. We're just not pushing it out into our social media. Thanks for that. I forgot about that. Mm-hmm.
All right, now we're on to the live questions.
Okay.
So this is from Angela. So is the CDC recommending nursing homes and long-term care facilities to go back on lockdown?
No, I don't believe there has been any lockdown advisories at all. These situations of when an agency needs to stop visitation or stop inward or outward flow really depends on the situation of that population within that building. So each agency will make that decision based on whether or not they're having escalating issues or not. And I would hope that before they do that, they're applying greater and greater layers of mitigation strategy, which is what we want everyone to do. So each level of disease transmission that's going up, you want to add layers of strategy to reduce that. So you want to add layers of masking and social distancing and restriction of visitors. And then if there's still no impact, testing, there's a lot of things that should be put in place before there would be any kind of lockdown.
Okay, this is from Joe. Hello, do we have a rough estimate on how many Delta cases are in the county? Or how it's affecting those who are vaccinated.
Okay, so I just mentioned that the state has advised us that all cases are more than likely Delta, anywhere from 80 to perhaps 99%. So you take the number of cases we have and assume that most of them are Delta. Okay, so we have 122 new cases in the past 7 days, and at least 100 of them are likely Delta. The second part of that question is, what is the amount? So at this point, we are not hearing that there is more breakthrough infections with Delta with the current vaccinations than with the previous variants. The vaccination rate of coverage, I just pulled this out, overall, a person who's fully vaccinated with any of the 3 approved vaccines is getting infected at about a rate of 0.189%, or 0.2% of the case of fully vaccinated people are actually getting COVID infections, and that's current data. So I would say, well, I take that back. That's through July 21st. Okay, so we may need to adjust that. If we are seeing a higher breakthrough rate, we'll let you know, but I have not as yet been notified of greater breakthrough rates of Delta versus everyone else. We are aware that Delta is growing quicker. It's more transmissible, it has a higher contagious rate, and we're seeing the escalation of cases going up at a little quicker pace than we did with the other variant, which we're using into our modeling as far as when we may start seeing a significant number of cases.
All right, the next question is from Timothy. He said, I heard that people can make up their own vaccine card. So is there a way that you can make them different than the ones we got?
I don't know how to answer that question. I suppose there is, and if it becomes a real problem, they'll probably have to come up with some kind of a card that can't be duplicated fraudulently. Have you heard anything about that? I haven't. But there is a system that can't be duplicated and cheated on, and that's the MICR system, the Michigan Care Improvement Registry, which only certain people have access to. Joe Blow cannot go in there and, fill something out and say he was vaccinated. He couldn't. So if there is any doubt of vaccination status, a person can, in fact, confirm their vaccination status through the MICR. And if you have an employer that maybe is suspecting that you're not, their employees are, whatever the situation is, they would be confirming those vaccination statuses in MICR, would be my thought.
Okay. The next question is from Nikki. She said, heard this morning on the Today Show that the Pfizer vaccine is only 42% effective against the Delta variant. Is this true? What's your thought on it in regards to vaccinating 12 to 15 years olds?
That's from one study. I was going to say I have not heard that one yet, but I don't have time to read this stuff, usually for until the weekends when I can actually have time to read. So what I'm being told is that is a single study that has come out, and I don't trust anything that's based on a single study. We call that cherry picking, and there's a lot of potential for confounding and bias. So what we do is we wait for the body of evidence to guide us, and that would include from our own breakthrough case rates, in the state, and further information. Would we expect that with some of this variant activity, there may be a lower vaccination efficacy? And the answer to that is yes. Okay, we do know that about these variants, and that's one of the great concerns. But the current vaccine effectiveness with Delta still appears to be very good. And so what I don't want people to think is, oh, the vaccine isn't good anymore, I shouldn't bother. That's certainly not the case. But we'll see if more studies suggest that low vaccine efficacy. I would doubt, quite honestly, it'll be that low, from how I understand this. So we'll see.
All right.
Oh, there was a second part of her question. There was a second part of her question, by the way. I saw something about, what about 12 to 15-year-olds? Thank you. My thoughts on 12 to 15-year-olds is that it's important to protect everyone in our population. The data on 12 to 15-year-olds is very solid. It's basically says that the vaccine is just as good and just as safe. Same amount of vaccine adverse events, which are primarily local: tenderness, fever, body aches, fatigue, and that there was no increased risk in any way. And since our 12 to 15-year-olds, 12 to 19-year-olds, and even younger are all susceptible to this virus, I think it's important to protect them.
All right. The next question is from Tim. He said, is herd immunity still at 75%?
That's always been kind of a controversial question. I've been seeing bounced around. And personally, I've never thought it was 75%. That's pretty low. And I think they use that to make people feel better. Something this contagious, looking at something like measles or chickenpox, herd immunity is upwards of 80%. So I would be surprised if it's that low. And of course, we're pretty far away even with that. I just saw some data from the state. If you combine what we expect, people having natural immunity from wild infection and vaccine-induced immunity, we're still under 65% statewide. So we're still a ways away even from that 70% mark. So get vaccinated. That's the message I have for all of you. Go ahead.
The next question is from Karen. She asks, I know this virus is probably microscopic, but could scientists study its movement in the air?
Sure, they do. And of course, it's microscopic. Viruses are some of the smallest living particles we know of. I think prions might be a little smaller, but prions are even weirder. Okay, so yeah, you can't even see a virus with a microscope. You need an electron microscope to see viruses. So it is being studied, and it, of course, does circulate in the air, but we are pretty confident that the respiratory droplet theory is appropriate, not because it's how it's acting, it's how it's behaving. It's what we know as far as who gets it and who doesn't go it. So even though when you talk about aerosolized virus, that has been noted to occur in procedures that aerosolize respiratory particles, i.e. if you're in the hospital and you have a bronchoscopy or some kind of a procedure that stirs up that the respiratory mucus, that could become aerosolized in a medical setting. But I don't believe there's been any studies that have shown that level of aerosolization. Well, that's the word. The virus being in an aerosol type of situation in the I want to say the real world, in our world, right, where we're just kind of walking around normally. So I would only be concerned about that aerosol piece if you are a healthcare worker working in situations where you may be doing procedures to the airways.
All right. Next question is from Robert. Are we going to receive a booster? And if so, when? Thank you.
Yeah, big question keeps coming up. The ACIP is meeting tomorrow to discuss boosters in immunocompromised individuals. So the first thing coming out will probably be some guidance on whether immunocompromised people should get a booster shot. We'll go from there. And we have vaccine available. I want to tell you that we have the vaccine, so no worries about shortages. We have vaccine appointments available, adequate, I'm sure, to accommodate everyone's needs. The vaccine's available at pharmacies, so no issues there. If it comes out that whatever medical condition you have is included in recommendations for booster, you schedule your appointment, you get a booster. And if it goes beyond that, where we have to booster everybody, well, we as a health department will figure that out and be there to help you get those boosters.
All right, the next question is from Mitzi. She said, I have a hard copy of my vaccine card. Is there an online version?
Well, there's the MICR version, right? Which, again, I just mentioned you don't have access to. A layperson can't just go in and type in their name and get into the system. You can request it. So can you request it online, though? Her question is she can see it now. So if you need another copy, you're going to have to ideally call our staff, and we can make arrangements for you to get a copy, and that comes up a lot. I think I lost my vaccine card too, by the way. I need it. So you call, we go into the system, verify that you've been vaccinated, then we can generate another card. But I don't believe there's anywhere you can go online to get your own vaccination verification. I don't think so. And if that is not true, I will announce it, or someone will announce it soon, as I'm not aware of anything like that at this point in time. It makes sense. It'd be kind of nice if they had that, but I don't think it's built.
All right, this is from Tim. He said, with the Delta Plus variant on the verge of coming, how has the study shown on the vaccine blockage?
Delta Plus, I'm assuming he means maybe the Lambda version. I mean, there's so many variants now. There's hundreds of variants, and they all have different concerns. There is some of the variants clearly do have significantly less efficacy with the vaccines. I should put this, the vaccines have significantly less effective against some of these variants. Whether these variants are going to show up in our country and take hold and become significant player remains to be seen. And each one is unique and each one is different. Here's what we can say about variants. The more you allow this virus to replicate, the more likely these variants are going to become an issue. It's another great reason to focus on our immunity by vaccination, because the less this virus replicates, the less likely it's going to show up as a dangerous variant. If we keep letting it having these surges, we're just going to kind of see one after the other. So this is another part of the urgency that we have right now. This is not just like a flu season or, la-di-da, we got this infection. This is really rather urgent, so we can get on top of this and not have to deal with worse and worse variations of this virus.
All right, the next question is from Sue. She said, do you do COVID tests to enter the border?
Yes, we do. Yes, we do. We're fortunate enough to have rapid COVID, both PCR and antigen tests. To cross the Canadian border, you need a PCR test within the last 72 hours. We are encouraging people to make an appointment. You can get these PCR tests, by the way, at other places, but you can't get them rapidly. You have to wait usually a day or two to get those results back from like your pharmacist, MedExpress, etc. So plan ahead if you're crossing the border, because we only have the ability to do so many per day, and we don't want to turn away testing for people who are ill and need to know whether they have COVID or not, in lieu of people who just need a test to travel. Okay, so that's becoming a little bit of an issue for us internally. So I'd urge you, if you're planning to cross the border, to plan ahead, schedule an appointment with us as when you need it, and or go to one of the other places you can get a PCR test in time to cross when you want to.
And just so people know, they can schedule an appointment on our website, scchealth.co, and under our vaccine testing section, there is a self-scheduler. Okay, next question is from, let's see, I missed one here. You kind of already answered it, from Linda. What is the chances of us needing a booster for the vaccine? But you just covered that. Jonathan said, are your numbers like Florida?
No,
and need to be
we're not like
adjusted?
Florida at all.
Okay.
And need to be adjusted. Oh, I'm sorry. The question is, do we have big issues? I'm not aware of any big data collection issues happening in Michigan. I mean, data always has to be scrubbed and cleaned and adjusted. That's the nature of data. Raw data is never clean and publishable, right? That's why I keep telling everybody, when you look at our day-to-day data, you have to understand that that's real-time data, and the final versions are going to look a little different after we have a chance to delegate cases to communities like outside of our county, and there's all kinds of things we do as we validate this data, so it changes the numbers. But I am not aware of any large-scale discrepancies of cases or deaths or hospitalizations or any of those important data points.
All right, the next question is from Linda. She said, when will children under age 12 be able to be vaccinated?
It's a common question. We're hoping soon, right? I have heard possibly by the end of this year. That's kind of outside the realm of my mind. A lot of that depends on how quickly the pharmaceutical companies can gather the data that's needed. Again, safety data is not compromised when we rushed this. They still need the same amount of information. They need the same kind of information. They need the same degree of review, and all of that takes time. So pre-published, have you heard? No, honestly, from some of the expertise at Mayo and Paul Offit, I think they keep saying they think maybe by the end of this year. So we'll find out.
Linda asks, what is the percentage of children getting COVID?
I have to look that up. We have a graph somewhere. We'll get back to you about that, Linda. It's not zero, by the way. In fact, we have a percentage of hospitalizations for children with COVID. So although we do consistently see that less children than adults are getting seriously ill, I would say the number of pediatric infections is actually pretty decent. In fact, it may be one of the higher rates because kids play together. When they're in school, they spread it through school events, especially last year with the sporting events. So there's a difference between the age ranges of diagnosed infections, but I think even more importantly that I want to emphasize is COVID is not a nothing disease for children. And we go back to what do you consider significant infection in childhood? I would tell you that if I had a child that was hospitalized, that was a completely preventable hospitalization, and God forbid that child, including had to be intubated or some of these difficult situations, I think that's a really meaningful statement to say that these are all avoidable, preventable illnesses.
Somebody asked, and I'll paraphrase, if you can still get COVID or pass COVID when you're vaccinated, why get vaccinated at all?
I just mentioned that because your risk of getting infected with COVID after being vaccinated is very, very small. So you still have a much, much greater risk of being infected if you're not vaccinated, okay? But if you are unlucky enough to be infected as a fully vaccinated person, we know now that that does not prevent you from spreading it. The other thing is you have a much greater risk of being seriously ill as an unvaccinated person. If you are vaccinated, you are highly unlikely to get ill enough to be hospitalized and highly unlikely to die. Which tells you, right, that if you're vaccinated and you are unlucky enough, if you're that like 0.2% person that gets infected and you're spreading it, there's a much greater chance you're also going to be not that ill, okay? And when you're not that ill, you walk around, you do stuff, you go to the store. And that's another reason why masking recommendations have started to change, because if you're not that ill and you're walking around thinking, well, maybe, I can't get infected because I'm vaccinated, that chance of transmission unwittingly is there. So that's the real issue, is that we want everybody to realize that this virus is sneaky and you can get infected and spread it without really being ill at all. Okay, and that's the problem. If every time you got infected, you were covered with a rash like chickenpox, okay, pretty visible, it's a lot easier to handle. This virus infects and replicates and gets shed and infects other people before you even know you're sick. Okay, which is why it's so important to add these other strategies. That's why vaccines and masks are so important.
So sort of on the same lines, Marilyn asked, I read what rhinovirus was and some same symptoms of COVID. We had no vaccine for that or so many other viruses. Why?
Well, rhinovirus doesn't kill people that I'm aware of. I guess it could. Any virus can go rogue and cause unusual symptoms. For instance, some of the rare side effects were associated with the vaccine, Guillain-Barré, myocarditis. Those are all well-known post-viral complications, okay? So you get a viral infection, you can have these secondary complications, well established, associated with routine viral infections. But generally, we are more concerned about viruses that harm people in a significant way, causing hospitalizations and deaths, okay? Not to mention this virus is a nasty one. It takes long COVID. There appears to be some significant long-term implications of infection as well. Go back to our question so I can read it so I can see what it is. So symptoms. Look up the symptoms of almost every respiratory virus that exists to mankind. They are all the same. Okay, so all symptoms of viruses are kind of generalized, which is why it's hard to know whether you've got COVID when you have a stuffy nose and and some body aches, because that's true for a lot of viruses. So we develop vaccines when the benefits outweigh any risks that could be associated with it, including the risk of the cost and the socioeconomic impact of producing and distributing vaccines. So that's why. You don't create a vaccine for a common cold that really nobody really gets hurt from, other than having some sniffles. Okay.
Okay. Doc, it's 4:01. Do you want to continue until
Oh, yeah.
4:15? Okay,
Sure.
so just to let everybody know, we have to end no later than 4:15 today. All right, the next question is from LC. Is there going to be an order put through that only quarantines unvaccinated children this school year?
Well, the current status is if you're unvaccinated, you are much more likely to get infected from an exposure. So unvaccinated children will need to quarantine, and vaccinated people generally have not had to vaccinate. So that hasn't changed. That's a guidance that's been going on all along. Also, you don't have to quarantine if you are recently recovered from a verified COVID infection in the last 90 days. So if we can assume immunity, we're not going to quarantine. If we can assume non-immunity, we're going to probably quarantine. Masks, by the way, will also impact quarantine. Just saying that right now.
All right, this is just a thank you from Michael. He said, Dr. Mercatante, thank you and all the wonderful staff at the health department so much for keeping people like my parents safe. Deeply appreciate everything you all do. That's we're thankful for that comment.
You're
Thank
very
you.
welcome.
Okay, next question from Lisa. What's your best advice for teachers to keep our kiddos safe?
Wow, it's not the teachers that are going to keep the kiddos safe. It's the kiddos that are going to keep the kiddos safe. They're all in the same room. So the best advice for teachers is to get vaccinated. Okay, teachers are eligible for vaccine, and they should, as many as possible, should be vaccinated, because that will highly increase the chances that they won't get infected themselves and unwittingly take it into the classroom. My personal advice and our recommendations officially to the schools is that teachers and staff, as well as students, should mask, especially as our rate of viral transmission increases. So if we're in a low rate of transmission like we were in June, I would say that wouldn't be necessary unless you had a special situation. But if, as I anticipate, returning to school in the fall is concomitant with a fairly substantial level of viral transmission, I believe everyone should be masking. The other thing teachers can do is keep their students apart. Okay, try and keep them spaced apart, so if there is an exposure, it doesn't affect everyone in the classroom. Try and make sure that the kiddos wash their hands, that the surfaces are kept clean, and keep your eye open for anyone who's ill that may have escaped the attention of their parent before they left for school. Sick individuals should not be in school. They should be sent home until it can be proven that they don't have COVID, okay? And they're better. So those are just kind of the general rules, and I think that's the general rules for everybody, everywhere, businesses, schools, pretty much churches. It's for everybody. It's what we need to do to protect ourselves against this virus.
The next question is from Nikki. Did the CDC have a conclusion on the heart inflammation on young boys after vaccination?
Yeah, it was a rare increase with the Pfizer product only, and it seemed to be, oh, well, of course it was, because it was only associated with the under 18. It was a rare, I don't have the numbers. Do you have the numbers, It's extremely rare. Again, I'll go back to a natural an infection with the wild virus results in myocarditis at a much, much higher rate. So again, it's the relative risk. Also that the risk of that myocarditis did not outweigh the benefits of the vaccine, and they are continuing to recommend providing vaccine. And the other thing I think I heard is that there was all of it, they were all very mild self-limited cases. So important to be aware of, but not a reason not to get vaccinated.
All right, the next question is from Tiffany. Will school boards have the ability to make masking decisions for their districts? Any thoughts on St. Clair County schools? Sounds like state of Michigan isn't going to dictate.
School boards do have that right, and in my opinion, perhaps that obligation to protect their students. We are talking to them regularly. And again, I think at this point, I don't think any of our schools, based on what I've heard, are really seriously considering a mask mandate. And we're going to see how that works out. We're working with them and walking this walk with them, and we'll just take it one day at a time.
All right, the next question was from Ann June. Last winter and spring, the health department pushed for lots of testing of symptomatic and asymptomatic people to stop the spread. A few weeks ago, someone from the health department told me that while anyone could get tested there, they were only recommending it for people with symptoms. What's your current recommendation and why?
I think anybody who thinks they've been exposed should get tested. And I think if you're having symptoms, I'm not sure what advice they gave you or why, but if you have an exposure and you're not ill, test yourself. It's testing is a great tool, and I know we had a lot of pushback with tools, but especially these antigen tests, they're cheap, they're safe. Yes, there's false positives and false negatives. It's not perfect, but it's a great tool to identify infections early. Or as I mentioned, if you have an infection that's not causing a whole lot of symptoms, it'll identify that so you know not to carry it onward into other social situations. So I would encourage testing. Now, just, I guess if you have no reason, if you've been nowhere and haven't done anything, just to get a test, it's a resource limited question, and I think maybe that's part of it. But certainly exposed individuals and any who are asymptomatic should get tested.
Linda asks, can we get COVID a second time?
Yeah, absolutely. And that's one of the concerns with relying just on a natural infection and not bothering to get vaccinated. We know that people who've had COVID are much less likely to get a second infection after vaccination than just leaving it to their natural infection. So the answer is yes. I'm going back to how much. I don't know that we have a number. What do we have any estimate? Here's my data guy over here. That keeps changing as far as what we would think is a kind of a potential risk for that. But it's not a ton of people, but it's real. I want to say like 10%. Is that wrong? Repeat infection. So what he's saying is that we as a health department have about 120 to 130 confirmed reinfections. That's from a previous confirmed infection, right? And that's out of 18,800 total cases. So that tells you it's kind of rare, but not impossible. That's way less than 10%. Way less than 10%. Yeah. But I've seen some studies that kind of go there, and I guess it depends on what country you're living in, what the circumstances are. Remember, a lot of this has to do with viral load. And this is why masks are so important as well. If you are walking by somebody who happens to be infectious and a few viruses filter down into your system, that may not cause any significant infection or detectable problem. If, on the other hand, somebody stands in front of you and talks to you and you are assaulted, invisibly, of course, with millions of viral particles, the chances of you having a real infection are much, much greater. And so, reinfection is probably somewhat related to that as well. What that viral load is, what the person's susceptibility is, do they have underlying medical conditions, blah, blah, blah. So it's a complex question that's probably going to take us a while to really have a solid answer for.
All right. Peggy wants to know, how do you know if you're asymptomatic?
Well, you don't unless you're tested. That's my point. That's why I said testing is so good. You don't know if you're asymptomatic means you have no symptoms. So, I mean, and I just said you can't taste or feel or see a virus. It's too small. So, sometimes people have very mild symptoms. So that would be something to pay attention to. But if you truly have an asymptomatic infection, that means you have no symptoms at all. The only way to identify that is with a test. Okay, testing will often identify that. Okay, so the test.
All
To
right,
make
it's
the test.
4:10. We have 5 minutes to go, and I'll get to these as quickly as I can. Linda asks, why don't we hear anything about the flu anymore?
Well, last year was a real low flu season, and from my understanding, most of the experts believe it's because there was a worldwide masking campaign that was going on, which is extremely effective for a lot of respiratory viruses. So that's probably why. Now we did have flu. We had cases. It just wasn't nearly to the amount we normally see. So we'll see what happens this year. Flu season usually starts anywhere from October to January, February, and we'll see what happens as this season as well. The flu's not gone, but it was markedly knocked down. I think because of all the things we were doing for COVID.
All right, the next question is from Christina. With school starting in a few weeks and cases starting to go back up, are we looking at another school year like last year?
I hope not. I think the one thing we can all agree on is we all want our kids to be in school. Now, will school be exactly like it was in 2018, 19? I don't know how we can say that if we know that there'll be a lot of this disease circulating. We have one fight at the health department, and that is to prevent this, and we're only fighting over one thing really, and that is to prevent this disease from impacting people, at least trying to reduce the impact. Okay, so we're not going to ignore viruses that are, COVID transmission in a classroom, but we are going to try to work very hard to keep kids in school. And that's probably the best I can say. I can tell. So I was going to say, so studies from last year's school year, where most schools had mandated required face masks, showed us a couple things. With universal masking, the transmission of COVID in classrooms, even during times of high community transmission, was very, very low. Low, okay? Which tells me that if everyone's wearing masks, we could probably keep kids in the classroom, perhaps even after exposure, okay? But if we go the other route and nobody's doing anything and there's no masks and there's no social distancing, we don't have anything to bank on. And then we have to use our kind of standard 6 feet, 10-day quarantine. So we have a lot of work to do to keep our kids in school, and we have that work to do together.
All right, we have two more questions and then we have to close. So this is from Sandra, back still on the flu info. When will we have, well, excuse me, will we have to take a regular flu shot like we always did every fall?
You should. No one's recommending not. I just mentioned flu is still around. Flu hasn't just disappeared. And one of the other theories of why flu rates were so low is we did have an increase in people who took the flu shot, not wanting to get a flu infection back to back with a COVID infection. So yeah, flu vaccine will be available as normal, usually in about August. Pretty soon we'll be getting our flu vaccine in, and we would be recommending everyone to get their flu shot. Absolutely.
Kathy asked, what about sharing a food at a family get-together and you know that there are unvaccinated family members present?
I am not aware of any reliable data that indicates that COVID is transmitted on food. Okay, what it is transmitted by is people standing near each other eating because you can't eat with your mask on, right? So masks come down, people are talking, chit-chatting, eating, and that's the risk. So unfortunately, that means when you're eating in a situation where there's unvaccinated people, move away from the crowd. Get yourself at least 6 feet away from them to eat your meal. That would be my first recommendation. And then when you come back to that group, put your mask back on. So it's not the eating, it's the mask down and talking and being near people, and breathing near people.
All right, so we'll end with this last question, and then people can watch back the show. We put this on YouTube as well. They can go to our health department YouTube channel to rewatch it as well. If they had a question, you can send us questions to COVID-19 at stclaircounty.org or call us on our hotline. So this is the last question from Nikki. How long will this virus continue before things are somewhat back to normal?
Oh,
Best
we get that
guess?
every week, don't
We
we?
do.
This is what I think. I don't think the virus is going to disappear. I think we're going to get better and better at learning to live with it, and our immunity rates are going to increase, and it's not going to cause these huge surges and pressure on the hospital systems. It will become more of what we call an endemic infection. So an infection that just kind of circulates at a lower grade and that we can address at a little easier level. So be prepared to hear about COVID, I think, for a very long time. I'd be surprised if it just disappears. But I think it'll become, and don't forget, we're going to have better treatments. We're going to know more. I mean, my gosh, we've had to figure all this out with less than 2 years of studying this virus. So we're going to know more questions about serology. Does my immunity count? How do I know I'm immune? I think all of those questions are going to be our answers are going to get better and better, which means people will have better understanding and tools to stay well. And I just want to say one more thing I thought about with the quarantine. I want people to understand that isolation, which is making sure sick people are not continuing to participate in social and congregate events, sick people stay home, and quarantine, where people who are exposed and are potentially incubating an infection, to remove them so that they don't inadvertently infect other people. These are techniques that we use for all communicable diseases. Yet we do it for chickenpox. We do it for measles. If there is a measles case in the school, we look at everybody in the school to see who has not been vaccinated, and they are excluded from school. So please don't think that we're doing anything special or punitive now on this vaccination versus unvaccinated status. It is really just standard of care. Public Health 101. This is what we do.
All right.
It's not, I'm saying it's not, what's the word I'm trying to think of? We're not picking on anybody. Okay. We're not picking on anybody. That's not the word I'm trying to think of, but you know what I'm saying? Okay.
All right.
Sorry.
That's it.
That's
Thank
it.
you,
I have
everybody,
one
for
more
watching.
thing. No, I have
go
one
ahead.
more thing to
Oh,
say.
go ahead.
This is
Go ahead.
important. Okay. So we have some important things that I am asking all my staff to emphasize these things, because I think it's really important. There's a lot of angst, right? And you can feel it. It's like you're staring down this barrel. It's coming in. Oh my God. I know, right? All right. So number one, we understand we get it. We know how hard this is for you. We even understand your anger, your frustration, and your inability to really understand some of this stuff. We get it. We want you to know that me, Brandon, all of us are part of this community. We live here. Our kids go to school here. So what's
I
happening to
do.
you? What's happening to you is happening to us. I mentioned that the only fight we're interested in is trying to control and contain this next outbreak. That's where we're at, okay? It's not about constitutional rights. That's our job, is to control and try and reduce the impact of this outbreak. And finally, I want to just say that it's time. It's time for all of you who care about your health and care about each other to do the right thing. If you are unvaccinated, it's time to put on that mask and maybe stop throwing those bonfire parties and just kind of like, pulling back a little bit. If you're considering getting vaccinated, now is the time to get vaccinated. People need to take responsibility for helping us do this. There's only so much we as public health professionals can do, and it's up to each one of you to do the right thing. You know what the right thing is. We've been talking about it for almost 2 years now. So I would suggest that now is the time that you take those steps to reduce the transmission of this virus yourself. So with that, I want to thank you all. We're going to have some guests over the next couple of weeks,
Yeah.
and I will be back in September. But we'll still be here next Thursday at 3:30. Thanks.
Thank you very much.